Hi everyone, I'm Dr. Domingo and welcome again to my vlog. Today I'm going to talk about COVID-19 just to once again reiterate the seriousness of the pandemic. So our stats from this morning, up to date, we've had 224,665 cases. In the past 24 hours, 8,811 new cases were reported, and we've also had 3,600 deaths up to date. So what we need to be aware of is that for the first 109 days of lockdown, we managed to get to 100,000 cases, and 14 days subsequent to that, the numbers doubled. So this is obviously expected because of the lockdown being lifted, but I think it's important that we realize that we are now more at risk with more services being available. So that's something that we have to bear in mind. I want to speak a little bit about masks. I know a lot of people have different opinions. Some people are unhappy with wearing the masks. On Monday, I posted an article about the importance and the benefits of wearing a mask. I think it would be nice if you can read that if you haven't read it yet. And the most important thing is that there's no evidence against wearing a mask. So nowhere is there anything that says do not wear a mask. And I think that's very important to realize. People are saying that they're having difficulty breathing with a mask. So with a mask, you are putting a physical barrier on your face. So your work in breathing is naturally going to change. You might feel that you're using more energy to breathe. That does not in any way mean that you are short of oxygen, or hypoxic as we call it, and it also doesn't mean that you're being poisoned with carbon dioxide. The public have been advised to use cloth and surgical masks, and those masks, you can breathe very easily with those masks. You can use N95 if you really want to, but because of resources, everyone's been advised to sort of keep that so that the care workers can get hold of them. Staying at home is still very, very much important. If you are in a position to work from home, please continue to do so. I've heard a lot of people saying that, no, I haven't been anywhere since the start of lockdown. I haven't seen anybody. But remember, you have to go to the shop to buy groceries. You're going to the petrol station. Those are also things that put you at risk if you are not following the necessary precautions. So I just want to remind people, please don't be in denial. Don't say, oh, I haven't been anywhere, and think that you won't be affected, because you still could. I had a patient who tested positive for COVID-19 a couple of weeks ago, and he also said to me, I was at home since the beginning of the lockdown. He only went to the garage, he only went for groceries, he always wore a mask, always followed the precautions, but he had somebody coming to visit him at his house from time to time. And it happened that this person was actually sick before he started developing symptoms. So please be very careful. Yes, it's good to stay at home, but there's no point in saying I'm going to stay at home, but then you let people come to your house and you visit your family and your friends. You can still contract the virus that way. One other thing that I also want to touch on is I've seen a lot of unhappiness about regulations changing on a daily basis. I think we have to remember that this is a new virus and we are learning more about it every day. So things will change. It might seem chaotic, but that's why I think it's better for people to focus on just staying safe. And I'm just talking about what's happening in the health sector now. So every day projections change, every day stats change, every day there's new approaches to how we manage it, every day there's new evidence for treatment. So it is changing and we are learning as the situation is evolving. So I think that's something to bear in mind, and not to put too much pressure on the healthcare workers. There is also now emerging evidence that the virus is in fact airborne. But the World Health Organization has said that their regulations, their safety precautions they put in place initially was with bearing in mind that it could be airborne. But now they are busy working out a brief, and then they will give us an update based on all the evidence that they've received. I would also like to, I think by now everyone has noticed that all of us can be affected. So whether you are rich, whether you are poor, It doesn't really matter. No one is immune. And that's what I want everyone to remember. Nobody is immune. Nothing guarantees that you will be fine. So even if you have no comorbidities, don't think that that protects you. I've heard people saying about blood types, blood type O. There's evidence for that, but nothing is conclusive. And at the end of the day, that's not guaranteed to save you as well. So please keep the main thing, and that is to stay safe, stay at home, wear your mask as much as possible, don't visit with family and friends. If you have to go out, practice social distancing. Make sure that when you go buy your groceries that you're getting as much groceries at a time as possible, so that you're not going to the shop every day, because then that would be pointless. Avoid touching your face. Wash your hands regularly with soap and water for 20 seconds at least, and keep sanitizer with you when you are unable to wash your hands. And that is basically it for today. Thank you.